Hey everybody, so today's video blog is on somewhat more of a general topic than what I usually talk about. So the topic today is on cancer treatment. And really sort of broadly speaking, there's four main categories of cancer treatment in sort of modern medicine. So we're not talking about like traditional medicine or lifestyle changes. So for cancer treatment, there's basically four broad categories currently. So those categories are number one, surgery, number two, radiation, number three, chemotherapy, and number four, biologic agents. So, cancer is basically a collection of abnormal cells in the body, and those cells are growing without any control on them. So this is a tumor or a mass or something like that. It's just sort of growing out of control. So obviously with surgery, the way that the cancer is treated is by removing all of the cancer cells surgically. And by doing that, the goal is to remove all of those abnormal cells from the body and thus cure the cancer. So that one's pretty simple to wrap your head around. So the second way of treating cancer would be radiation treatment. So what radiation does, so it's basically a beam of energy that is targeted onto the cancer or the tumor cells. So radiation basically damages DNA within the cells of the tumor. And unfortunately, the radiation also damages normal DNA and normal cells in your body. So for that reason, the radiation, especially these days, is very highly targeted to try and really hit the cancer cells, but not hit so much the normal cells in your body. Though, there's some varying degrees of success with that. But the idea basically is to kill the cancer cells by destroying the DNA with radiation. So the third treatment option for cancer is chemotherapy. And chemotherapy are basically medications and drugs that are used. And really they work usually in the same way as radiation does. So typically they target either DNA in the cancer cells or other mechanisms that those cells use to divide and grow. So the chemotherapeutic drug then enters those cancer cells, and either it throws a wrench into the DNA replication system, or something that allows those cancer cells to grow and divide. So it's sort of throwing a wrench into that system. So again, like radiation, the chemotherapy drugs, it doesn't discriminate. So it attacks the cancer cells, but it can also attack normal cells in your body. And for that reason, people tend to get a lot of side effects with chemotherapy, such as hair falling out or nausea and vomiting, or, all of those sorts of things. So again, it's a very blunt instrument. It does potentially work very well at killing cancer cells, but it also causes a lot of side effects and, damage to normal cells in the body. So the final cancer treatment, and this I would say is a more recent development, maybe in the last 10 to 20 years, this has really started to take off. But these are biologic agents. And what that means is this is also a medication or a drug, but it's been developed so it very specifically attacks the problem in the cancer cell. So if there's a specific mutation within the cancer cell DNA that's not in our regular cell's DNA, the biologic drug can actually go in and really attack that certain problem. So say in a particular tumor, there's a mutation in the DNA that causes that cell to not produce a chemical that normally stops cells from growing. Okay, so this is called a tumor suppressor gene. And with that, the normal cells are producing this substance, and it kind of puts the brakes on those cells from overgrowing and going wild like a cancer cell would. So in the cancer cell, obviously that gene and that protein's not working. So you've sort of lost a brake on its development. So what a biologic agent can potentially go in and block that abnormal development from happening. And then, it very specifically targets the cancer mutation, but it doesn't really have so much effects on the rest of the body. So it's sort of like a chemotherapy in some ways, but you get much less of the side effects with the rest of the body. So a lot of these medicines can be very promising, and sometimes can actually cure cancers. and can certainly slow them down, to allow for other treatments to work better. So, in sort of modern medicine, I'd say these are kind of the main 4 pillars of treatment. With the types of cancer that I normally see in ENT specialty, these are like mouth and throat cancers, thyroid cancers, and then some blood cancers like lymphomas and things like that. These are what we see typically in the head and neck. Different types of cancer, typically would get different combinations of treatment, depending on, how patients do in terms of their prognosis with these varying treatments. So again, this was, I'd say, sort of a general video, not even so much ENT related, but, if you or someone has been diagnosed with cancer, it's probably going to be a combination of one or more of these main treatment options that they'll be offered to try and treat and cure their cancer. So anyway, I hope that's helpful, and I'll see you guys in the next video.